Why do I get UTIs after sex? Honeymoon cystitis. Have you ever noticed that after intimacy, you feel the urge to go to the bathroom more often or experience a burning sensation when you do? This common issue is often called honeymoon cystitis, and it happens because sexual activity can sometimes introduce bacteria into the urinary tract. The bacteria most often involved are Escherichia coli, which normally live in the gut or around the vaginal area. When these bacteria get into the urethra, the tube that carries urine out of the body, they can travel up into the bladder and cause an infection called cystitis. Women are especially prone to this because their urethra is shorter and located closer to the anus and vagina. This makes it easier for bacteria to enter during or after sex. The term honeymoon cystitis originally referred to infections that happen after frequent or first sexual encounters, like during a honeymoon or after a period of not being sexually active. Several factors can increase the chance of developing a urinary tract infection after sex. Mechanical irritation or minor trauma to the urethra during intercourse can make it easier for bacteria to enter, especially if there is poor lubrication or pelvic muscle tension. If anal and vaginal areas are not properly cleaned before sex, bacteria from the anal area can be transferred to the vagina and then to the urethra. Hormonal changes, such as those that happen after menopause, can also make the urinary tract more vulnerable. Some women are naturally more prone to recurrent UTIs, especially if they experience infections triggered by sexual activity. The symptoms of a UTI after sex usually include a strong urge to urinate, a burning feeling during urination, frequent trips to the bathroom, and sometimes pelvic discomfort. If you notice these signs, it is important to see a healthcare provider for proper diagnosis and treatment. Untreated UTIs can sometimes lead to more serious infections, like kidney infections, so prompt care is essential. To help prevent honeymoon cystitis, there are some simple steps you can take. Urinating immediately after sex helps flush out bacteria from the urethra. Using adequate lubrication during intercourse can reduce irritation and minor injuries that might allow bacteria to enter. Avoiding practices like anal to vaginal penetration without proper cleaning can also lower the risk. Staying well hydrated and practicing good personal hygiene are important too. For women who experience frequent UTIs, a healthcare provider might recommend taking a single dose of antibiotics after sex as a preventive measure. If symptoms of a urinary tract infection develop, it's important to seek medical advice quickly. A healthcare professional can confirm the diagnosis and prescribe antibiotics to clear the infection. Treating UTIs early helps prevent complications and reduces the chance of recurrent infections. Chronic or repeated infections can cause ongoing bladder irritation, which over time might affect bladder health. While most UTIs are treatable and do not cause long-term harm, persistent inflammation can sometimes contribute to bladder problems, so managing and preventing these infections is key. In summary, UTIs after sex happen because sexual activity can introduce bacteria into the urinary tract. Taking preventive steps like urinating after sex, maintaining good hygiene, and staying hydrated can help reduce your risk. If you do develop symptoms, prompt medical care is the best way to protect your bladder health and avoid complications. Always consult a healthcare professional for personalized advice and treatment options.